Hey guys, it's Charlie Wade here, your leading expert in natural pain management and other chronic diseases. Wanted to jump in today and actually discuss a few of the myths that surround sickle cell disease trait. Now, before I get into the whole myth aspect of it, I want you to sort of understand some of the reasoning why a lot of these myths even come about is because of the fact that either lack of research and or lack of not getting retested later on in life. You got to understand that a lot of the 60s and 70s and early 80s and sometimes even beyond, that there was only two labels. Either you had sickle cell disease, or then it was called sickle cell anemia, or you only had the trait of it. It was just years later that we had all the SS and the SC and the SAs and the beta thalassemias, thalassemias, and sickle cell beta thalassemias and all these other things. So all these categories got changed probably about 10 to 15 years ago. And in this, like I said, in the 60s, 70s, 80s, even beyond them, it was a matter of either you have the trait or you don't have it, or you had the disease, or actually just had the trait itself. So that's when a lot of these myths start to sort of come about, because individuals in general that only displayed the trait were usually asymptomatic, or a lot of the symptoms were not even associated with having sickle cell disease, or they were so mild that it was just passed off as you're tired, or these are just random myalgias. I recall even myself when I was younger. I used to have these constant, pains in my sides, or pains in my legs, pains in my hips when I was younger. And all the doctors kept pointing and say, hey, look, you're a growing boy. It's just long bone growth. And some people can experience pain beyond that. I can recall from age, I think around 7 to age maybe 10 or 11, going to the doctor quite often over this. And again, it is one of those things where a lot of these symptoms are usually being passed off, as far as like not being that severe, or you're not in need of immediate medical attention, things of that sort. So there's a few things I just want to throw out there to you. How you doing now, Belle? How we doing today? And Ms. Monish, if I say your name wrong, I'm going to say love always. How about that? Nice to see that you're on as well. But again, this is a very sensitive topic for a lot of other individuals, because I'll take it to myself again. How you doing, Miss Carter? To myself again, I recall when I first started being on Facebook and trying to really put information out there and show individuals I had even had the trait, and quite a few individuals said, "Oh, you only had a trait; you don't really count." But then when I told people my story, as far as like me, having many pain crises, especially when I played sports, or being in college and things of that sort, they slowly start to understand that individuals with sickle cell trait. No matter if it's the thalassemia or beta thal, whatever it is, we can experience a lot of the same symptoms as individuals would, as the common term is the full-blown sickle cell disease itself as well. So I'm going to go ahead and try to dispel some of those myths, and that's right there. It's actually one of them. It's a situation where you have to understand every person is different. Case in point, I have a 17-year-old sickle cell SS kid that his hemoglobin is always around 12. When I say always, I think the lowest I've seen this kid's hemoglobin was 11.4. He plays lacrosse. He plays soccer. He's a scholar student. He normally doesn't come in here to see me because he's having a sickle cell crisis. He's usually always injuring himself. And the reason I can say sort of tell you that his hemoglobin always stays around 12. We always have some sort of blood work done on him. He has had some done last week, and the lowest I saw, like I said, was 11.4. So that's an SS person. Everyone is different. I'm saying this because even with trait, you gotta understand environmental things. You gotta understand stress level. You gotta understand that everything you have, it really depends on what sort of situation you're dropped into. I've had patients with sickle cell trait and have to have fingers amputated because of AVN. I have individuals with sickle cell trait that again have pains in their hips, or have to have they have AVN inside their hips or shoulders. I have individuals with sickle cell trait that same exact symptoms. So long story short, don't assume just because you have the trait or that weakness of breath you may have or that pain that you always have when it get cold or whatever, it's not always arthritis. It can be the fact that you're having a minor sickle cell crisis. I've actually traveled around the world, fortunately but unfortunately, for work, and I mean I've had humanitaria. I've had, crisis, in the air. I've had crisis as soon as I've landed, and usually even now when I do fly, especially international, I tend to, if I have an event that starts on let's say on a Tuesday, I'll try to get there by Sunday to give myself an entire day's rest to relax and recoup just in case anything happens as well. I still do that myself. So, it's a huge myth that individuals again do not experience these crises, and I always try to teach people, especially parents, and as I talk to the parents about their kids or another loved one, I also hitting on different pain points, and they're saying things like, oh wow, wait a minute, I do recall during my period, or the father would say, well, I used to run and get shortness of breath, and I'm like, those are all things that are associated with sickle cell trait. That we do get shortness of breath a little bit faster. It takes longer for us to recover from certain things. We do get colds and flus if we're living unhealthy lifestyles. A little bit more frequently and things of that sort. So you got to be very, very careful, parents. I know a lot of you guys that are actually on here today have kids with sickle cell or have sickle cell yourself. So all the symptoms I can go down, I know you guys are experiencing, and I know. Most of you guys are on here because you're trying to do better for your child or even yourselves, but you also got to do the same things you're doing for your child for yourself as well. Because the average life of a sickle cell trait person is actually shorter than the average lifespan of a normal individual as well. So you got to be careful. I tell people all the time that I already know personally I have a slightly enlarged heart and also a slightly enlarged liver. And actually, I found this out in medical school. We were doing different exams. They were like, "Oh, you should be fine." And we started doing scans on being there. Like, "What? You have a slightly enlarged heart, slightly enlarged liver." And they were like, "Well, you have the trait. So if you do experience pain crisis, things of that sort, you would have a slightly enlarged, heart and also liver as well." So I try to be, careful with everything that I do. And yes, I'm telling a lot about my own medical history because I want you guys to understand that the reasoning why all that I've done for this community is not because of the fact that it's a theoretical thing. I was trying to help myself, and by helping myself, by the grace of God, I'm able to help millions around the world. So I don't know what's wrong with my phone and everything else is reconnecting and connecting. So hopefully you guys are still getting this. But anyway, the other trait is the fact that I'm sorry, I went for a tangent, but the other myth that a lot of individuals think, and I think I maybe went over 2 or 3 of those myths in that one conversation, but one of the other myths is the fact that individuals with sickle cell trait, beyond crisis and things of that sort, does not have to have the precautionary standards as a person with sickle cell disease. And not as many. And I say that because of the fact that, yes, we can play sports. Yes, we can do different things, but we also have to be very, very cautious. Think about all the basketball players that actually had sickle cell trait and actually died. Think about the football players, the same thing. It's soccer players that even have, had the sickle cell trait and also died as well. So there are a lot of precautionary things that you also have to put in place for ourselves. I was even alluding to the whole flying thing. We can definitely fly, but we have to also be precautionary because of that. Myself, I always told you guys I love to drink green tea, and I try to drink green tea because one, the caffeine is a natural vasodilator, but I don't like to overdo it. I just do one cup a day now versus the 8 cups I was doing the day before. But I do try to drink a lot of herbal teas. Herbal teas, one, to keep me hydrated. A lot of antioxidants in there with me since I have a high stress job. I try to do things that keep me nice and relaxed and calm, versus me always being stressed out, because as we know, stress is one of the most idiopathic things out there. And with sickle cell trait individuals, that's when we tend to actually have our most crisis. I had a really, really bad crisis my 3rd semester of college, and the reason I had a real bad one was that was when I first step into a lot of my major classes, and I was taking like 21 credits like an idiot, and also trying to work as at the same time, and it didn't work, and I just crashed, and I actually was out of school for 2 weeks because I had really bad pain, and well, I had a sickle cell crisis, and then I also had got the flu. Maybe like the second week of me actually being out of school, so I was getting better, and also I caught the flu. So again, like I said, I'm making this very, very personal. I want you guys to understand that, other things I do. So other precautionary things is, yes, we can go to college, we can play the sports, but let's be mindful about being hydrated efficiently, about having phenomenal diets that are really accustomed to who we are as a people in our situation, knowing that we can't have the greasy foods or the fried foods or too many carbohydrates and too many sugars and things of that sort. And also, ironically enough, you gotta understand that we in this group, we shouldn't have a high protein diet. I'm not saying don't have any protein, but I'm saying not a high protein diet, like the protein shakes and things of that sort. It's been just some research saying that how it's hard for us to digest the food, and when it's hard for us to digest the food, our bellies are working a lot harder, and that can actually take away from the blood production and things of that sort. So you gotta be very, very careful, especially with dietary things, and just take different dietary programs that can actually help benefit you as well. So the second myth really is the fact that, we're completely fine, but we have no issues. So the first one was we do go into crisis, which is a huge myth to say that we don't. The second one is the fact that there are specific precautionary things that we should educate ourselves about. And I know some great individuals online now that do some counseling with sickle cell trait individuals, also sickle cell people in general, but there's not enough information out there. And the last one is the fact that individual with sickle cell trait should never marry a person with sickle cell trait as well. And this is a very, very taboo subject. And I've had people ask me this for the last, I say, 15 years, knowing that I'm in this realm. And I always tell individuals, you got to be careful with anything you do. There's a lot of great genetic testing right now to sort of say that, you're able to sort of to see what the child, the child is going to have or not have. And the whole myth is you can do anything you want to do, but be smart about it. I'm not going to personally answer that question, but I'm going to just say be smart about it. Be very, very mindful of everything that you do, because right now there's about 1.2 million individuals with sickle cell trait in the United States right now. Because the ratio goes, and actually it may be a little bit more than that, because the ratio goes that there's 10 times or sometimes 100 times more individuals with sickle cell trait than sickle cell in that particular country. Like take a country like Nigeria, or let's go ahead and use a country like Jamaica. They say over a third of the individuals in Jamaica, or even more than that. It can almost say like 40% of people in Jamaica has sickle cell trait itself, or sickle cell disease. Sickle cell trait and also sickle cell disease combined together. So it's almost half the country that's carrying around, this genetic mutation. I was using that term, so I kept wanting to choose the right word. It's a genetic mutation. So in other countries, it can be as little as, it can be as little as like 1%, not even 1%, or it can be a lot higher as well. So again, you gotta realize that, at some point in time, you'll come in close contact with someone that may actually have it. And also, don't be fooled the fact that if you date out of your race, that the person won't have it. I have quite a few Italians that actually have sickle cell disease itself, or sickle cell trait. The family that blonde hair, blue-eyed, white individuals that actually have sickle cell disease and actually come for treatment. I have individuals that are from Turkey, from Pakistan, from the Middle East, from all these different regions that actually have sickle cell disease or sickle cell trait. So you got to be very, very careful with everything you do across the board. So the whole marriage thing, I always say, just be mindful of who it is. And another full disclosure, when I was younger, I didn't tell anyone I actually had sickle cell trait, because I didn't know anyone else that was like me. I thought I would be singled out, and actually eventually I was sort of singled out. My last couple of years of high school, I wasn't allowed to play sports like I used to. I was only allowed to play one sport. And they singled me out because of the fact that I had sickle cell trait. There was a lot of information that was coming out around there about individuals dying or have other issues as well. So they said, no, you can only play one sport. It devastated me, but I understood it at the time. But I'm sort of saying this because of the fact that, again, the more information that comes out, the more research we're able to do to help each other out, the more we're able to really educate ourselves. And for me, the reason why I didn't want anyone to sort of know was because, like I said, I didn't want to get singled out. But the moment I actually was able to speak about sickle cell and tell people what it was, it was very, very liberating for me. And I never used it as a crutch. I never used it as a pass, because the first person I actually told I had sickle cell trait 2, or sickle cell beta thalassemia is what I have now. I'm classified now, whatever, was my physics professor. Because again, the time I told you I got really, really sick, it was during the time that I actually had physics, and he was gracefully enough, he didn't fail me because of my condition. And the reason why I never wanted to tell anyone, because I didn't want to feel like I was using it as a crutch or a pass or whatever. And and I told him that, and he did finally say, he said, no, this is the situation that's very, very real for you. And he actually thanked me for telling him. And of course, he let me retake the exams and things of that sort. But at the same token, he said that at the beginning of every semester, I had to tell everyone exactly what was going on. And, it didn't make things easier for me, not necessarily, but it made them understand that if I wasn't in class, I wasn't not in class just lollygagging or not wanting to take their course. I could be in pain or things of that sort. So, make sure that, we give, each other a proper platform to speak on. I think that's the other thing is, we each, either want our voice to be heard so loud, or we don't give others a proper voice and things of that sort. Realize that, we're here in this whole thing together in some way, shape, form, okay? I try to have as many answers as I can for you guys, and that's why I try to do these lives as often as I can, to answer questions, also to dispel myths, to give very, very, very good pieces of information that I know is not out there very largely, or is out there and people are not using it efficiently. But when it comes to sickle cell trait, you have to be very, very careful to just sort of sweep it under the rug, because you can't just sweep it under the rug. Like I said, I know individuals who completely and utterly die just from having a trait. It's not individuals that were in a sports situation or in the military, just everyday ordinary people that just had complications because their trait would just manifest itself as being the disease. And that's the thing about genes that you guys don't understand. And one reason why right now I'm in the middle of taking a genetics and also epigenetics course, get my degree in that now, is to understand and help you guys understand what it really means to have this situation. Because what happens with your genes is, what happens with your genes is they code for one thing, but again, your lifestyle, your environment, all those things play in how those genes are really going to express themselves. So a situation like myself, who always put a lot of pressure on myself to be the best academically, and also when I played sports, I put that pressure on myself as well to be the best that I could be. So that was a lot of pressure, internal pressure I was doing. So I was always internally stressed. So that just, again, let myself be a good petri dish to have any sort of crisis happen or any sort of infection happen to myself. And that did happen. But individuals who are nice, relaxed, and have great environments, whatever, they may not ever experience any true pain at all. So that's why I try to give as much information to help you guys understand from a genetic standpoint. Just because you have something does not mean that it's going to overtly express itself and be a negative thing. You may have it, and you may have minor complications here and there. That's one reason why, from a nutritional standpoint, I'm always heavy on people when it comes to what you put in your mouth. I'm always heavy on individuals about how much rest, how much stress you also allowing yourself to actually feel on a daily basis. So things like that you just gotta be very, very mindful of. As always, guys, if you have any questions, any comments, whatever, you want to have a discussion about sickle cell trait, because I can go on and on and on for hours, but I got to go back and see patients now. But if there's any kind of discussion you want to get on with this, please tag me in on any discussion. I'll try to lend my knowledge from a scientific standpoint and also a medical practice standpoint, from what I've seen, also on what the research has shown me for as well. I don't want to say the person's name, but this young lady, she's actually writing a book about her journey, about how she started her child and using our products and doing different parts of research. And when I put the research out about sickle cell patients are traditionally, and most of them are zinc deficient, and she started having her kids tested, and all across the board they were all deficient, and her and her husband have the trait, they had themselves tested, and they were also deficient in zinc as well. And by supplementing themselves, they saw that the colds and flus just sort of went away. These are bits of information that when I put the information out and you guys start to use it, and it comes to the point where this person said, that information basically changed her life and her child's life, I know I'm doing my job, and I will continue to do my job, and try to give you guys as much information that I know is really going to help you and give value to you guys' life. And these simple health upgrades that I keep I'm telling you guys to actually do are designed not because I want you guys to be vegan or tree huggers. I'm trying to improve your health and add more value to your lives as well. So just know that because you're here for somebody else, I know you have the trait or you have the disease, so please start listening to what I'm saying and just implement some of these things here and there, and you'll see the difference in your life. All right, guys, if you have any questions, please feel free to reach out. If not, I'll talk to you guys very, very soon. Again, I'm Dr. Charlie Ware, your leading expert in natural pain management and other chronic diseases. Talk to you real soon, guys. Bye.